If we delay everybody, then we're going to have more advanced cancers, and it's going to be a bigger burden on the system.
The 2020 COVID-19 pandemic is having some serious side effects on medicine. We are seeing people skipping their preventive screenings for a variety of diseases, including cancer. And this is really sending out warnings and alarm bells across the country. We're talking about that now with Dr. Steve Lester, a radiation oncologist and the co-founder of the Central Florida Cancer Care Center. Thanks for joining us.
Oh, thanks for inviting me.
You betcha. I was doing some research. There was a recent survey. It was from a group called the Prevent Cancer Foundation that found that 35% of respondents said they did skip cancer screenings because of fears over COVID-19. When you hear that, what do you think?
I think it's unfortunate. I mean, when it first started in Florida, there was only like 1 in 1,000 who were infected in the area. And when you look at, say, breast cancer, the risk goes up, especially when you're over age 65. You're much better off putting a mask on, going to your imaging center where they're doing a lot of preventative issues, cleaning, social distancing, screening patients before they come to the door, and getting your screening tests. It's really not, I mean, you have more exposure going to the grocery than you do go and get a mammogram, or if you have to go to your family doc or urologist to get a blood test for like prostate cancer screening. So it really was unfortunate. Now, part of it was the lockdown, and they said, well, is it essential? Well, sure. I mean, you can probably delay a mammogram 1 or 2 months if you have no palpable mass, if it's a screening mammogram. But it delayed everything, and it bunched everything, and now it's kind of bunched things up, and people are having trouble getting in. If it goes on for too long, we will see more advanced cancers.
I was going to ask you about that. In this survey, more than 1/3 of the respondents putting off cancer screenings. If this continues, what do you expect to see in the coming months and years?
Well, my experience in the 1980s in Louisiana when we had an oil field depression was that the patients came in later because they lost their insurance. So whether you're coming in later because you don't have insurance or because you're afraid of COVID, you have more advanced cancers, especially in patients who start having symptoms. You would argue that's not even screening. It's like you got a mash you can feel or some symptom, blood in your urine, you need to go see your doctor. If you're really nervous and the screening is at a hospital, then change it to an outpatient facility away from the hospital, though. I think you're pretty safe going anywhere with regards to being screened.
Dr. Lester, many of the patients that you do radiology for as part of their treatments are treatments with breast cancer, prostate cancer, and skin cancer. How effective are breast cancer screenings, skin cancer screenings, and prostate cancer screenings based on your years of experience in medicine?
They're very effective, and they've gotten more effective. Let's take breast cancer. When I was in training in the 1980s, less than 5% of the cancers we saw were called non-invasive or intraductal breast cancer. Now that's 30%. That's just the mammograms have gotten better. So right there, we've taken and gone to 30% of the screened patients who we can eradicate the cancer at 99% of the time versus waiting till it's an invasive one that has risk of spreading elsewhere. We didn't have PSA when I started in the 1980s. PSA has made a dramatic difference in the stage where we see patients with prostate cancer. Skin cancer, you just know you want to get it before it's big or it has deep invasion. It's kind of a given to know advanced stages have poorer survival. You want to screen them, you want to find them earlier, and that's really the most logical thing I can say about it.
And let's talk about how that affects the treatment plan. Better outcomes and maybe a less painful experience for the patient sometimes?
Almost always. If you take, say, let's use breast cancer. If the breast cancer is confined to the breast and it's small, it may be able to be treated with simple excision, what's called a lumpectomy, and followed with breast radiation. And you may not even need chemotherapy. You may only need some sort of hormonal manipulation. That's much less toxic than having to have many lymph nodes removed, have breast and nodal radiation, and have systemic chemotherapy. It really is a no-brainer. Get screened. You're much better off knowing than not knowing.
Some great insights today. Dr. Steve Lester with Central Florida Cancer Care Center. Thank you so much for your time today.